Hi guys, my name is Lexi, and today I'm going to be talking about my experience with the Nexplanon birth control implant. So I first heard about the birth control implant several years prior to when I got it. A good friend of mine had gotten it and she really liked it. It was a super easy process for her and I thought it would be great for me. So about 2 years later, we had a 5-month-old daughter and I decided it would be a good time for me to get the implant. We weren't wanting kids anytime soon after that. We wanted to wait a few years and it just seemed like the right time. So on Tuesday, October 27th of 2015, I went in for my birth control consultation for the Nexplanon implant. I was super excited. At this point, I had 3 friends who had the implant. They all had great experiences with it. So I go into the doctor's office. I have my 5-month-old little girl with me, and I told the OBGYN that I was interested in getting the Nexplanon implant. And she basically said that was great. She could do it that day if I wanted her to. It wasn't really discussed with me or like what the side effects could be of it or anything. And she went and got it, and I decided to do the procedure for it that day. So the midwife that I was meeting with was not my regular midwife. The midwife that delivered my daughter and was with me all throughout my pregnancy became very popular, and so she was booked out like 3 months in advance, and I figured, you know, it's a really simple routine procedure. I don't need anyone that I know or trust to do this for me. So they lay me down on this bed, and the nurse is holding my daughter, and the midwife is on the one side of my arm. She has it all sterilized and, you know, just the typical stuff that you have to do to get things clean. And she brings this big needle over, and I wanted to see it, and it's like this huge horse-sized needle, and she put local anesthetic on it so that I wouldn't feel the pinch as bad. And she puts it in my arm, and it wasn't that bad of a pain. But when she goes to insert the implant, I get this horrible, sharp shooting pain down my arm. My hand just went numb, and the closest thing that I could describe it as is lightning. So immediately I tell her that it really, really hurt, and she doesn't really react to that. She goes to take the needle out of my arm, and she just kind of stops, and she looks at the nurse and goes, "I can't get it out." The nurse looked completely terrified. Like, usually medical professionals are really, really good about keeping their cool and assuring you that everything is fine. She looked completely terrified, and she goes, "What do you mean you can't get it out?" And the midwife was like, "I can't get the needle out." And so after some fidgeting, it was really painful. They finally were able to get the needle out of my arm. And then I had some really bad bleeding that wouldn't stop, and they had to apply a pressure bandage to my arm to get it to stop. So that was that. The only other thing that the midwife said to me was that I would know if my body was rejecting it. I wasn't given like care papers or anything. I wasn't given instructions. I was told just to continue with my normal routine and that it would basically heal itself. So I go home that day. It feels like I got punched in the arm. You know, that's kind of what I was expecting. My friend came over that evening who also had the implant, and she said that that's what she had experienced as well, and it was nothing to worry about. So the next day, about 24 hours later, I take off the bandage, and I noticed that there was no swelling or bruising at the injection site, which I thought was a little bit weird because both of my friends who had the implant had told me that it was very common to get the swelling and bruising, and on one of the online kind of like mommy chat groups that I'm on, it had been discussed on there, and most of them said that they had gotten swelling and bruising really bad after they had it inserted. So I could not feel the Nexplanon on the surface of my skin. I was under the impression that immediately after insertion I would be able to feel it under my skin. I was very gentle with touching it when I was trying to find it. I didn't want it to get moved or misplaced. I didn't want to have to like go through the procedure again. So I was very, very cautious when I was handling it. But when I would gently touch my arm, I noticed that I'd get a very sharp shooting pain down my hand. So not being able to find the Nexplanon concerned me a little bit. So I went online, I started doing some research. Why can't I find my Nexplanon implant? You know, does swelling cause you not to be able to feel it? Stuff like that. And they said that you should be able to feel it right away, and that your provider should show you after insertion how you can feel it and where it should be, and that you need to check it on a regular basis to make sure it hadn't moved. My provider did none of that, and I couldn't feel my implant, so it concerned me a little bit. I called my friend that night and I asked her if she could feel her implant the day that she got it or the day after she got it. And she told me that, yeah, her provider had showed her the implant and that her care paper said that, she needed to be able to feel it. And she said, "What does your care paper say?" And I was like, "Well, I don't have a care paper. They didn't give me anything to take home." And she was really shocked when I said that. And she said that she had gotten a little pamphlet of care instructions of how to take care of it and how you need to be kind of careful with it and what you should expect, what are the signs that something is wrong with the implant, and just the whole 9 yards. I didn't get any of that, so I was kind of clueless what was going on. So the next day I called the provider and I said that I couldn't feel the implant, I had no swelling or bruising, and it just didn't feel right. Something didn't feel normal, it felt off. And they told me that I had swelling and bruising that I couldn't see. It was under the swelling, so I wouldn't be able to feel it, and to give it a week and make an appointment then if I was still concerned. So on Friday, October 30th, I was hanging out with my mom, and I started to notice that if I would try to straighten out my arm, I would get a really painful, sharp shooting pain down my arm, which again felt like lightning. If I was holding my arm bent, it wasn't so bad. It was still obvious that I was in some pain, but I thought it was just from getting, the implant, and it was just normal. The concerning part came when I lost feeling in my pinky, my palm, my pointer finger, and my thumb, and then all the way up my arm. It slowly kind of started as a tingling and then worked its way up to my elbow, and it didn't really ever pass my elbow, but I lost feeling in my arm. So I called the nurse hotline, and they suggested that I immediately go to urgent care. They would call ahead for me to reserve a spot and to get there as quickly as I could. I started freaking out a little bit at that point because I was like, something is really wrong here. So I got to the urgent care around 5 p.m. They were really good about getting me back right away. The doctors that they have at urgent care are not OBGYNs, at least at the urgent care that I was at. And they didn't have any on-call OBGYNs who could come down and kind of assess the situation. So the doctor that I was seeing, he was a super, super nice guy. His wife had an OBGYN that they were friends with. So he called him and was like, "Hey, I can't feel this girl's implant. Should I be able to feel it? She just got it 2 days ago. What am I looking for? What do we do?" And the doctor, sure enough, said that we should be able to feel it immediately. And with any kind of pressure, it should be very obvious that it's there. It's about the size of a toothpick. So it's pretty obvious that, you can feel something under the skin. It shouldn't be hard to find. So he did another thorough search on my arm. He had a nurse and another doctor come in and look at my arm and see if they could find it. No one could find it. It was Friday at this point. He said if the pain got any worse, to go to the emergency room immediately. If not, to make an appointment Monday as soon as I could get in to have it looked at. So the next day was Saturday, Halloween. I couldn't use my arm at all at that point. The pain was really bad. It was almost unbearable, but I just really wanted to tough it out and wait until Monday because I didn't want to have to go into the ER and wait and go through all of that. So Sunday morning comes around and we wake up and decide that it would be best for me to go to the emergency room because I was having so much pain in my arm. I still couldn't straighten it out at all without a terrible pain. The farthest I could get it out was about to here before feeling like something in my arm was just going to break and my whole hand was numb. I couldn't feel anything. It was really bad. So I go into the emergency room. One doctor and 3 nurses look in my arm and try to find the implant, and they couldn't find anything. They couldn't feel it. They had no idea where it is, so they ordered an x-ray. So the x-ray comes back and you can see the implant. It's right under my armpit, right next to the bone. Keep in mind that the implant is supposed to be right on the surface of the skin where it almost looks like it's not even in your arm on the x-ray, it's right under the surface of your skin. It had moved up and was basically on my bone in my arm. Regardless of that situation, I was told that I was not a real emergency and to go home and keep my appointment for the following Tuesday, which I had made the day after I got the implant put in when I called to say it didn't feel right, to keep that appointment and to just go in then. So Monday, November 2nd rolls around. My arm is numb, it's extremely painful. And I called my doctor's office and I say, hey, I have to get in. Can I please have the next available appointment? Something is really wrong with my arm. I have been to urgent care. I have been to the emergency room. I've spoken with the nurse's hotline. Something is really wrong here. Please, 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 can I get in? I was able to get in the same day at 3 p.m. Thankfully, I was able to see the doctor that actually delivered my daughter. She is so nice and I trust her 100%. So she comes in, she's feeling around in my arm. At that point, she was kind of like, whatever, you're wasting my emergency appointment. Like, this is not a big deal, obviously. So she comes over and feels my arm. She can't feel the implant. She calls a nurse in to come look for it, and the nurse is looking and like digging around in my arm and trying to find it. They pull up the x-ray from the day before, and they see that it's right up against the bone, and they're like, well, that's not good. She shows me her implant. She had the same one. It was not only right at the surface of the skin so you could feel it, you could also see it under her skin. That's how obvious it was. You couldn't even feel mine. So she calls in another doctor. This other doctor comes in, she's digging around, she sees the x-ray, and she's like, you're probably gonna have to be put under, have surgery to get it removed. I'm going to give you my emergency slot for surgery, and that I would be called by the next day to arrange it. I have a 5-month-old daughter at this point. I was nursing her. This was not an ideal situation because if you're put under anesthesia, you can't breastfeed for at least 12 hours. So that was really scary and it was really disappointing, and I really didn't want to have to go through with this. So the next day I get a call in the morning from a surgeon who says to come in as soon as I can for a consultation. So I go in and I see him. He thinks he can feel it up against the bone, but he's not sure. So he sends me for another x-ray. Thankfully the implant hadn't moved. It was still in my arm right up against the bone. At this point it kind of looked like it wasn't like buddy with the bone, but it was more like sticking on it. Like one end was on the bone and it was like a little bit sticking out. But it was still in the same area, which was really good news. The insertion site was down here, so it had moved all the way up here. So the surgeon that I got was an amazing surgeon. He was super, super nice, and he was very accommodating to me. I told him that I was breastfeeding and that I really didn't want to be put under. And he said that it wasn't a problem. It would probably be a routine 15-minute in-office surgery. So he said that he would just use local anesthesia, numb up my arm really good, and just take it out. And it would kind of be like a bam, 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 super quick procedure. So I go up to the front and I go to make my appointment, and they're like, okay, well, we have an appointment available a week from tomorrow. And I was like, that's really the soonest you have? And they were like, yeah, that's the soonest we'll be able to get you in. So my heart kind of sunk. I could barely use my arm as it was. That's really hard when you have a little baby at home. And I get a call from the office, and it was the surgeon. And he's like, look, I don't want this thing to move anymore. Tomorrow's my day off, but I want to get you in and get this thing out of your arm because I know how much pain you're in. So we make an appointment the next day at 8 a.m. to get it taken out. So my husband was asked to wait outside the room for a couple minutes while they did the surgery. He was told that, it wouldn't be that long and he could come right back in. So they get started on my arm, and he said he's going to do about a 1/2-inch incision to try to find it, and he should just be able to see it right away and get it out. So he numbs up my arm. I couldn't feel anything. He starts digging around in there, and he's like, man, this thing isn't where it should be. So at this point, he decides he needs to dig a little deeper, so he puts some more numbing stuff into my arm in a few more places. So he's digging around deeper, and eventually he starts saying, like, there's no way that this lady couldn't have known that she put it in wrong. Like, she had to have known that she did this wrong. And you can feel the tension kind of starting to build in the room. 15 minutes passes, he couldn't find it. 20 minutes pass, he can't find it. So he decides after probably about 35 to 40 minutes of searching that he needs to make the incision bigger. So again, he inserts more anesthesia into my arm, and he makes the incision bigger, and he's digging around again. So at this point, it had been about 45 minutes. So the nurse goes out in the waiting room to tell my husband that I was doing fine, it was just taking a little longer than they expected, and it probably wouldn't take that much longer to get. So she comes back in, and the surgeon is just really, really, really pissed off. Like, he was upset, and he was like just repeating over and over that the lady like had to have known that she did it wrong, and it was so far messed up and up in my arm that there was basically no way that it was inserted correctly. So the nurse asks him if he wanted her to call the lady that put it in my arm and ask her what the heck she did with it. And the surgeon says she's not going to admit it. She's not going to tell the truth, because if she didn't say anything when she initially put it in, there's no way she's going to admit it now and let us know what actually happened. So the biggest problem with the Nexplanon implant is that it is white, just like your nerves are. So when he was trying to find it, he would think he would find it, but it would actually be a nerve. So it basically blends in with everything that's already inside of your arm. So when he did finally find it, after about an hour and a half of digging and searching and pulling and tugging and bottles of anesthesia in my arm and lots of needles, it was under my muscle, embedded in one of the main nerves in my arm. Which is why when they initially put it in, I got the sharp shooting pain down my arm, and why I had so much numbness and tingling in my arm and my hand. As soon as he pulled it out, I knew. There was so much relief, and it was just like, oh my gosh, I'm human again. And we had like a little celebration, and the nurse was like jumping up and down and very excited, and he was really excited, and of course I was really excited because I wasn't really in that much pain anymore, besides the gaping hole in my arm. But there was just like, you could just feel the stress, just like, whew. So the nurse goes out and tells my husband, and he stitches me up. I ended up having to get 3 layers of stitches in my arm. My arm was in a sling for the next week and a half, and I had some nasty bruising. So I will go ahead and insert some pictures of what it looked like after I got the surgery. So if you're a little bit squeamish, I wouldn't watch this next part, because it's a pretty grody cut that I had. So it is now the end of July, and I still have a lot of numbness and tingling in my hand and my arm. I have since gone back twice to see the surgeon, just to kind of have him look at it and feel it, because I still have a lot of numbness and tingling. He thinks that I probably had some nerve damage, and we don't know that I'll ever be able to get that feeling back in my palm. I'll probably have to go do physical therapy. But I still have feeling and movement in my hand and my arm. I just have this one area on my palm that if you poke or prick at it, I can't feel it. I'll occasionally still get the sharp shooting pains in my arm, especially at the injection site, and some numbness and tingling in my hands. A lot of people have asked me if I'm going to try the birth control implant again in the other arm, and seeing as how the first one went, probably not. From here on out, I think we're going to be using natural family planning and stay away from all the medicines, just because this was a very scary experience for me. I don't ever want to have to go through it again. It was painful, and it was long, and it wasted a lot of my time. And not only that, I wasn't able to be there for my 5-month-old, who I just wanted to hug and cuddle all the time. I had to be getting surgery and taking care of something that should never have even been a problem. In the end, the surgeon did end up saying, had he had known how long it would have taken to find it and remove it, he would have taken me to the hospital and actually admitted me to the hospital and removed it under anesthesia, just totally knocked out, so I wouldn't have had to go through that and feel anything. But hindsight is 20/20, and if I was asleep, then I wouldn't have had a crazy awesome story to tell. So my experience with the Nexplanon birth control implant was pretty much a horror story and a nightmare, and I would never get it again. I do know people who've had a great experience with it, so it's just kind of a risk that you have to be willing to take. Lastly, I wanted to show you guys the scar that I still have on my arm from it. It is 8 months later. The scar has healed up really nicely. The scar started up here and it goes down there. It's almost all the way blended in with my skin. He did a really good job stitching it up, and it just looks really nice now. Well, that's it for this video. Let me know if you guys have any experience with the Nexplanon implant And if you have, leave a comment down below letting me know what your experience was with it. Thank you so much for watching. Remember to like and subscribe if you haven't already, and we'll see you guys in the next video. Bye.
You look like a news reporter. You're gonna give us the weather too?
And that is your forecast for today, ladies and gentlemen. We will see you tomorrow. Dun, dun, dun.